Okay, so here we are. This evening, it's the 6th of May. It's time for the May webinar for the Alphazita team, and we are really excited to welcome you to this one. It's a very special topic that the three of us are very passionate about, and we've really wanted to cover this in our own unique way, and it's going to be on the unseen side of fertility. I'm really pleased to welcome and introduce you to both Clare Spink and Gordana Petrovic and myself, Sarah Holland. We are three members of the Alphazita team. If you've been with us for a while, you may well have heard some of our other webinars on different topics. You have seen that we're a multidisciplinary team covering both medical and natural approaches to fertility and combining them together in a very effective approach. So this evening, the unseen side of fertility, we're talking about how healing the emotional and spiritual aspects can unlock your fertility potential. And this isn't something that you will hear your regular fertility teams talking about, especially fertility clinics and doctors. It's not something that is often embraced, but we are very proud to be looking at every aspect here at Alphazita and introducing you to all the different ways to support your fertility. So sit back, relax, listen, take on everything that we're going to be sharing with you this evening. We're going to be sharing different approaches from all of our different ways of working, which are diverse. You're going to hear a little intro from both Gordana, Clare, and also myself in a second. And what I'd invite you to do is just connect in with anything that you listen to tonight to see if it feels like something you do want to explore further, because this may well be different ways of looking at your fertility than you have done before. It might be opening your eyes to new things. It might be both exciting and it's slightly terrifying, who knows, but we're here to support you every step of the way after this webinar as well. We only have limited time with you. If you have any questions or comments for this evening, please put them into the chat box. We'll be happy to answer those as we go, as long as we have time. But we are going to be giving you more support afterwards, both in a way where you could be supported by the whole Alphazita team in person, and also ways that you can continue this work that we're talking about this evening. So lots to share with you towards the end of this webinar, but we'll get on with what we want to share with you now. So let's do some short intros to who is here this evening. Clare, can we start with you? Clare, tell us a little bit about yourself, please.
Just a very little bit. My name is Clare, and I am the creator of womb and fertility massage therapy. So it's a therapy because it's not just the massage. I very much delve into the spiritual and the emotional aspects. And I've been a practitioner for about 16 years and specialising in the womb and the fertility work for about 12 years now. So, see, nice and short.
Well done, nice and succinct. And Gordana, see if you can be as succinct as Clare was.
I'll try and match that of Clare. Yes, hi everybody. I'm Gordana, I'm the acupuncturist, and it transpires specializing in fertility and IVF support of my patients, as well as women's health and general health, and as it were, emotional health. Acupuncture is a very old part of a very old medicine, Chinese medicine, been present for about 5,000 years, and some things have changed, some never changed, and one that has never changed is, I just want to quote from the book of Elisa Rossi, one translation from the classics, which says all acupuncture methods must find their root in the Shen. And the Shen is a concept in Chinese medicine, which is the heart and the soul of a person. Because of the characteristics of Chinese language and signage, it's not that translatable literally, but this is where it all has to start. And very interestingly, that's the topic of our webinar tonight. We are all very, very, very passionate about, and I'm definitely looking forward to sharing that with you.
Fantastic. And I'll do a little intro to myself as well. My name is Sarah Holland. Within the Alphazita team, I am the Fertility EFT Coach. So a slightly different approach to the traditional maybe fertility counselling or coaching, in that I use a technique called EFT, which I will share a little bit with you later. But I am, just as you're hearing from the others here as well, I am focused primarily on the emotional side, using a very effective technique that draws on the Chinese meridian system. So whether that is negative emotions, thoughts, beliefs, self-talk, whatever is going on from an emotional mindset perspective, I look to support that and get women back to their most natural, healthy perspective on their fertility journey. So we've got lots and lots to share with you. We won't talk too much more about ourselves. We're going to be talking about you now and how we can support you on your fertility journey. So let's start, ladies, with the title that we chose for this webinar, The Unseen Side of Fertility. What do we mean by that, and why is it unseen or hidden? Claire, I wonder if you could start with that.
This is the juicy stuff that I love talking about. It's when clients come in, I want to know their stories. Why are they there? It's not just about their FSH and their LH levels or their ovaries. It's about what stories are they holding. So those stories may be cellular imprints. We start life inside our grandmothers. So when our mother is inside our grandmother, she has all the cells that are going to make us. So any patterns, any beliefs, any traumas that our grandmother has been through, they get fed through into our mother, and likewise down into us. And so that goes cellularly back through the ancestral line. So sometimes it's about looking at what are we holding. Sometimes we don't know why we have fears or beliefs or patterns that are running through us. And it may be that we never may know the real reason why they're there, but understanding that sometimes it may just be a cellular pattern. Other things that I love to know about are their birth imprints. How are they conceived? What was the mother's pregnancy like? And what was the birth like? What did your mother tell you about giving birth? Because sometimes if you've had negative experience or you've heard negative stories about birth, then you hold them. And I'll probably share a little bit more about that later on. But it's about knowing what those imprints are as well. And whether your mother maybe miscarried before you or terminated a baby before you. Those things can also run through within you. And I think one of the other things that I really love to find out about is how you feel about being a woman. And that means, how is your womb? How do you feel about your periods? How do you feel about your sexuality? And finding out what your womb wisdom is. And we do that by understanding the 4 different phases of our menstrual cycle and how that is emotionally for us. So there's lots of different things that we hold. We have fears that we carry through. They may be passed down. We may be holding on to loss, to grief. And so all these different emotions can be stored within us. And it may just be blocking our energy channels. And I think one of the other things to mention as well is, and I kind of learnt this from my own daughter, who shared her experience of remembering coming into me, to choosing me. And it's that sometimes these little souls that are coming through are higher vibrational, and they need us as their mothers to up our game in a vibrational, energetic way. And we need to clear blocks, we need to clear traumas so that they can come in a clearer way. So I know I will pass over to you, because otherwise I would sit here and talk for the whole of the webinar. So I'm going to shut up.
We did say, didn't we? We did say in our preparation meeting that we had for this that we are the 3 kind of chattiest, perhaps, people that we know, and we have so much to say that it's going to be really hard to stick to our time, but we're going to try. So Gordana, Claire has given us so much already, and I know I want to jump in and kind of add to it, but tell us what you would like to add. What does the unseen side of fertility mean for you when you see your clients?
Yeah, so please cut me when I start. if I start over, feel free, as per previous agreement. Very beautifully said, Claire. And I mean, it's particularly struck me when you, Claire, said at the beginning, it's not all about the FSH and LH and whatever. This is exactly what I try to not to talk about only about that, especially not in the intro consultation, first meeting. It really isn't all about that. Very often this final goal that our patients are wanting and they're moving towards just takes away the importance of the actual journey towards this particular goal. Yes, of course, we do need to know all the medical details. We need to know what is happening. But I, very much like you, Claire, I really want to know the story. I want to know how my patients are feeling, what do they think they're feeling and what they are not aware that they're feeling by the nature of our conversations, what things come up and how, whether they were aware of these feelings or not. So it's very important to look and read between the lines, so to speak, of the papers that we are presented with, and then in the conversation, look at the face, look at the body language, listen to the voice of a woman, and whether, or a couple, and how does that sound to, are they aware what is happening, and how does it feel for them? And very often I would hear things like, oh, I'm not really sure, I don't really know. What do you mean by that? And that implicates that that has not been addressed possibly before. And it's the most important part, which is then lost in all the testing and all the, getting on with coming into the clinic, being on time, presenting the results, and so on and so on. So the feelings are lost and people just get on. We are programmed to get on. We just get on, never mind. We have this final goal. We just need to go. And the journey, never mind I'm sad, never mind I'm happy, or I don't even know how I'm feeling. So that is what my goal is, to uncover that and touch really in the middle of that as my starting point for the whole journey.
And I think both of you there, Gordana, I'm not butting in, but I heard you come to an actual end.
Good. Yeah. Yay.
Both of you talked about having that chance to share the story. And I think that's something that makes our approach unique and very different from someone who follows perhaps solely a medical model, and especially if they're just going for fertility treatment where their appointments are very short and they don't have time to talk and explore and share and be honest about how they're feeling and what their story is to this point. How often is that included in a traditional kind of fertility consultation? So I think that's what makes our approach much more expansive and personalized. You both mentioned about giving that space to someone to tell their story. I also like to hear that, and I also like to hear what is your current experience as well. Like in my approach with them, I will ask, what is going on for you right now, and listening for those clues, isn't it, as to where you can hear fear, where there's hesitation, where they might be holding on to something from the past that is now being triggered again today, and just looking at where they are. And sometimes I find, often actually, that people bring so much to their sessions, because once they've decided that they want to have emotional support and they need emotional support, it's usually got to a real breaking point, and they have a whole ream of things they want to tell me, lots of different fears and worries and anxieties and stuff they want to resolve to support themselves and their fertility. But they're overwhelmed and they say, but where do we start? It feels impossible. How am I supposed to overcome all of this in, say, 3 sessions with you, Sarah, or whatever it is they're looking to book? And I always think it's a good idea, and we're going to move on in a second to tips and ways that we can support people in this area, but it's a good idea to start exactly where you are. So yes, everyone has a story and everyone has a past, everyone has a future that they're fearful about as well, and where are they right now? What is at the front of their mind? What is the thing that's waking them up in the morning and they're worrying about, or that's keeping them awake at night? What do they feel is their main priority? Because even if that isn't the key to their fertility, and we'll explore that with them, it's the thing that is perhaps using up most of their thought processes and their energy right now. So I like to start with them where they are and then carry on exploring in the directions that you both have talked about as well. So it's a great approach, and I can imagine people already are thinking, but what do I do, and how do I approach this whole unseen side, the emotional, the spiritual side? What kind of things can I do to start recognizing, acknowledging, and then healing this? So in this little section that we're going to talk about now, I'd like it if we could all share some tips really that we can offer the people listening today. What can they start to do, perhaps for themselves or with a practitioner? What practical things can they do? Claire, could we start with you again?
Yeah. One of the first things that I like to do with my clients on their very first session, obviously after I've heard their story, is at the end of the massage, is I place their hands over the womb, and I'll do quite a simple visualization with them, imagining that there's golden light coming through the top of their head and flowing through their mind, and just kind of clearing and washing away any thoughts that they're holding on to, and then allowing it to run down the left arm, through their hand, into their womb, flowing through their womb, their fallopian tubes, their ovaries, back up into the right hand, the right arm. So they've got the circle of communication, So as they're lying there with their hands over, they're connecting, they're feeling that energy flow. I then just ask them, say hi to your womb, connect to your womb. And despite the fact that some people think I'm a complete loony before they do that, after the session, they're really surprised that they've spoken, they heard their womb, or they may have actually been like really surprised at what shape or form their womb took for them, or what was unearthed for them. And I think it's a really good starting point to get women to just start connecting into their body, start to feel the energy flowing. Can they feel the energy flowing? And asking their womb. And it's something you can do tonight. You can all go home, or lie down. You're all at home anyway, hopefully. You can go to bed and place your hands over your womb, get the golden energy flowing around, and just start talking to your womb. You could be surprised that maybe during your dream time that you may get some messages. You may get some dreams of people or memories that come up that maybe they're the things that are blocking you. And I think it's a really simple starting point of just connecting back into yourself. And I often say to my clients, like I said in my first part, we don't always need to know the answers. Sometimes just acknowledging that something has happened, or acknowledging that we feel a certain way, is enough for it to be enough just to let go and to kind of go, okay, I acknowledge this, I honour this. And I think that for me is probably the simplest and the quickest thing that you can do. Alternatively, obviously, I've got 500 therapists pretty much worldwide. You can connect in with a therapist, go and have a session with them, and they can help you and support you on that. Because I think the most important thing that us as fertility massage therapists do, and probably as you guys do, but we hold you, we heal, help you to feel nurtured, to feel safe, and to feel in a space where you feel it's okay to be vulnerable and to let go.
What you said there, Claire, gosh, I've been under your hands a few times now, and it's a beautiful process to go through that visualization at the end. I clearly remember it so well. And it hooks into what you were saying before, wasn't it, about how you feel to be a woman and having that reconnection with the femininity, with the womb, and not feeling like there is some kind of block or disconnection. Lena commented, just as you were talking before actually as well, which still ties in well here, she said, magically said, Sarah, how you feel about, sorry, Claire, magically said, Claire, how you feel being a woman shows that we should expect and enjoy being a woman. This should not depend solely on our perception about fertility. Absolutely. That's everyday connection, isn't it? Yes. Thank you for sharing that with us, Claire. And how about you, Gordana? What would you suggest? What ways can they start to begin to reconnect and understand?
I love what Claire said. And yes, I know how passionate she is about that and how well that works. And I like what Lena said. Yes, just connecting to our femininity and our perception, who we are, where we are. And this is what I try to do myself. And I like what you said also about getting the starting point where they are now. So yes, we have the stories and the future is coming and the stories from the past, but I like that aspect as well. And what I try and do is I work with a lot of women who are in very high power jobs. So they're very busy, they're very away, and they're very unaware what is actually happening within themselves. Very often it transpires. So my approach is really, really simple in that respect, is that I ask them to set aside 5 minutes in their day to start with, to shut their eyes and shut themselves away from everything, the dreaded phone and all the other, electronics. So 5 minutes, because I find I would love them to go through a longer process and to start reconnecting immediately, so we can all see the results. I'm very passionate about it, but it's not good for everybody. And for a lot of my patients, 5 minutes, setting 5 minutes in their day just to start with, and to shut eyes, because then there is this physical barrier between the outside world and an inside world, and focusing on the in, and see what actually happens, what is happening in the mind without any expectation. So no expectations. If that can be achieved in those 5 minutes, it's probably, it's reportedly more likely than to set aside a longer period of time, especially when they're not used to it, and if they're not used to this kind of practice. So really feel what's happening, and whatever feeling comes about, no matter what it is, positive, negative, that's very relative. You know my views on that the positivity, and then some of my patients may be listening tonight, the positivity and negativity is the sign of the same coin, a different sign of this side of the same coin, and only in relativity to one another. So in every negative aspect, there is a drop of positive, and positive in positive, a drop of negative, which is the actual yin-yang sign that we know about, associated with Chinese medicine. So that is all okay. So the point where they come to accept that relative negativity and positivity are really just relatives, and that by acknowledging what is actually happening and knowing that it's okay, transforming this is the only way of moving forward. So it's not an easy thing. This is why it's a kind of a 5-minute job, or whatever they can set aside just to start with on a daily basis, and in between sessions report what has been happening in those 5 minutes. Because I do believe that, first of all, everything is acceptable. Every emotion is natural if it feels natural to the patient. We cannot disregard that and say, whatever. And positivity is hugely overrated. It's something which has just gone out of all proportion how it's viewed these days. And this perceived negativity and sadness and anger, these are all emotions we are prone to, and when they're expressed in the right context, they're absolutely natural, and they are necessary for us to evaluate the positivity of some other relative positivity of some other emotions. So the shutting down of the eyes, 5 minutes, going inward, recognizing what's happening, noting that in any which way they like. I leave it to them whether they want to remember it or write it down, and then see what happens, gradually increasing. And just this looking inward thing, which I find is difficult for many.
We're going to be sharing similar themes here, Gordana, and Claire as well. It all is creating space, isn't it, and stillness to be able to start this process. And
that's right.
What I was thinking of follows on beautifully from what you were saying there, Gordana, because if you are allowing that space and time to reconnect inwards and listen to what is going on rather than always the outside noise, my tips for the way that I work, and it's a very good preparation, is to start to listen to the self-talk as well. Start to listen to those voices that are coming in. Like, how do you talk to yourself on a daily basis? And how do you talk to yourself about your fertility? What are you saying to yourself when your period comes, or when someone else announces a pregnancy? What are you bringing back to yourself all the time? Are you being supportive and nurturing as you'd want your best friend to be, or are you being critical and blaming yourself and telling yourself that it may never happen, or whatever else, other unsupportive things? And it's very interesting what you said there about the negative positive side as well. And I know we chatted about this the other day in London when we met at Fertility Fest, because I think there's been a lot of kind of modern psychology approaches to positive affirmations and visualizations, and let's stay in a high vibe situation, and always trying to build up our positivity, but not recognizing the natural, as you say, naturally triggered negative thoughts and less comfortable thoughts and emotions that are underneath it. And if we carry on piling up the positives without acknowledging the negative that's underneath it, it's kind of festering away, isn't it? It's growing and it's wanting to be heard, and it's going to burst out of that box soon if it's been shut away. So yeah, in that 5 minutes, in the visualizations that Claire is talking about as well, and in my own listening to self-talk, and also I think journaling is a great practice to get into to start to empty out the mind and put it on paper and really understand what your thoughts are and what the feelings are. So however you're doing that and connecting with it, yes, if you are recognizing there are some negatives that are feeling uncomfortable and you feel like you're getting stuck there, maybe it doesn't feel like it is flowing. It's not as if it's just a cloud that's floating by, if it feels like you're stuck there and you recognize yourself being unable to move away from it, then that's a time when it can be useful to use a tool like EFT or any other emotional support tool to start transforming that emotion into whatever is natural for you. And that doesn't mean just covering it up with a positive affirmation. It means working through that negative, allowing it to naturally release so that you can discover your own most natural, positive and supportive mindset. And say it isn't always hugely 100% positive, but it can be something that feels much more comfortable and motivating moving forward. So yeah, there's lots of different different ways and things that people can do, aren't there, after this session to start exploring this. So the three of us together, we did add up our cumulative number of years in practice. It's something like 45 years or something crazy. So none of us look old enough for that, do we? No. And in that time, in those many decades that each of us have been working with fertility clients, gosh, we'll have seen thousands of people between us, you know, lots and lots of different stories, and they're all unique, aren't they, in their own way. I wondered if we could share a couple of examples, not necessarily, you know, unless those clients are happy for their stories to be talked about in detail, but more examples of where we've seen this work really have true power, you know, where it's been something that has seemed to be the missing piece, the unlocking that fertility potential. Do either of you have something you'd like to share?
Yeah, I'm happy to. I think one of the ones that I think is really common, and I've seen it happen quite a few times, is recognising when women come in and they have a fear of birth, of actually giving birth. And I remember one particular client who told me that she'd actually sat in the doctor's surgery that morning before coming to see me, opened up a magazine, and there was a picture of a baby coming out of a woman. And she said she nearly vomited right there and then, felt herself like tense up and just get like really hot and sweaty. And she said that she hadn't realised how strong that fear of physically giving birth was for her. And it is a question that I ask on my form because I want to know, how are they going to give birth? And it's surprising, quite a lot of people tick the box that, yep, they've got fear, but it's going to be okay because they're going to have a cesarean. So they've already decided before they've even got pregnant that they're not going to physically give birth. So with this, well, several clients I've done this, but this one particular one who had a fear, in that session I just took her back through, it's kind of like a journey of talking through a whole birth story. And because I've physically given birth myself and I used to be a doula, so I witnessed many, many births, I could do it in great detail and with a real positive approach to it. And the birth's not always going to be positive, but if we can try and switch how we feel about birth. And she did. We went through the whole thing and she didn't vomit on me, which was good. And she came out of that with, oh, this could be okay. And I think it's about learning as well to trust in your body and your baby and that you know how to give birth. We've been giving birth for millions of years. Thousands. So it's fine to know that our bodies know how to do this, you know, as women we are capable. And she did. This one particular client, she went off and she actually had a natural birth. She did no drugs, nothing. She gave birth naturally. And I think that for her was the block because she got pregnant not long after that. And I had seen her for quite a few months beforehand. And I've seen it with lots of other clients as well, where if you shift that birth and how they feel about it, it allows them to kind of go forward.
Yeah, it stops you putting up those barriers, doesn't it? Trying to keep yourself safe, because if it feels dangerous, risky, or risk to life to give birth, then why would you want to conceive then in that place? You know, why would you want to put yourself in that position? Whereas if you get that, like you say, more natural perspective on birth and understanding what it really is and you know, not having all the fear attached to it, then yeah, it suddenly feels possible. So yeah, definitely valuable work to do. How about you, Gordana? Do you have a quick example to share?
I've got lots of examples, but one example that is really stuck with me for years was exploring one woman's wish to be a parent, because she's, you know, we met, you know, she came in through a recommendation and from a friend who has had a baby as a result of our work together, and you know, years before that, and she had some difficulties and you know, in conception, and nothing physically, so one of those unexplained cases. And I sensed that there was something going on really in her approach to parenthood, the way she talked about her parents or whatever, and it transpired that she, you know, and her partner, she didn't tell her partner, but she really didn't want to be a parent. she didn't really want to go. She said, I really want to, and it's been years and we've been trying this and that, and it's all unexplained, and but and I thought, okay, so why is it? Why do you why do you want to be pregnant, and why do you want to have a family? What is your motivation to be a parent? She said, I really don't want to. I really don't want to be a parent. And I thought, oh, right, okay, oops. What to do now? What now? No acupuncture can work with that. But it actually wasn't true. It transpired after weeks of our work, and through acupuncture and through talking, and I'm a mindfulness practitioner as well, that she didn't want to be a parent because she was scared. Her mother didn't want her. So links into what we were talking, and what Claire was talking about the ancestry, about the background, and it was a long journey. But I remember from the point of her saying, yes, I've done everything I could. It transpired, no, I don't actually want to be a parent. And I thought, what's going on? And then it's through our work, through acupuncture and through mindfulness, actually transpired that she's had to overcome this great sadness that her mother actually didn't want her. And she was like all very confused, and things were very, very messed up at that point in her life. And she was very busy, and things were very obscured by all the outside noises we were just talking. And then in the end, she did become a parent. She has 2 children now. From not wanting to be a parent, from overcoming the fear. It took years of work on and off, and but it has worked. But that was an interesting case for me, because it wasn't so much about trying to conceive, but it was all this big thing about being a parent, being a family. It's a really big thing, and it happened relatively early in my career. A great challenge, but
it's just so interesting, isn't it, Gordana? Because that's again, it's someone being given the time and space to explore that.
That's right.
It's not the kind of thing they're going to typically talk about to their fertility doctor, or that they would even be given the time and appropriate space to explore it. So she might have been just as surprised by that as you were, and to be able to uncover those layers. And I think all 3 of us work a lot on family history, don't we, and what has brought them to this point. And it is fascinating to heal those wounds from the past. So thank you for sharing that one with us. A question has come in, which is actually going to preface what I'm going to share as well, which I think will go nicely. So the question was, do you think that this approach will also benefit the medical part of fertility, since through communication you might find something that could assist the medical treatment or make a suggestion? And I think all of us would say absolutely to answer that one. But what I was just going to share as my story was a wonderful lady that had been coming to me for support, and she was preparing for her next embryo transfer in her IVF cycle. And her previous embryo transfer had been very traumatic. She'd gone in feeling very anxious, very kind of convinced it wasn't going to work, feeling stressed from work. She had a very stressful job at the time. And she had what she said was a panic attack in the room where she was having the embryo transfer, and it made the transfer very difficult, very uncomfortable for her. It was just a very traumatic experience. And she said she left the clinic thinking, well, that's not going to work, because I was in such a heightened stress state. And she was right, the transfer didn't take. Whether that contributed or whether it was something else, usually a whole range of things, but she felt in her heart that was the reason why the transfer wasn't successful that time. And when she came to see me, she was a few weeks away from her next transfer, and she was thinking about going through that experience again, and she could feel her body tensing up. She imagined herself going into the same room, because it would have been at the same clinic, and reliving that traumatic response. And she could actually feel it as a tightness in her belly, and she knew that her body was going to respond again in the same way, or that's what she expected. And what we tell ourselves, we're sending that message down and our body's responding. So we did a lot of preparation. We had a really extended session, actually. I think it was about 3.5 hours together, with a tea break, I remember, in the middle. But we had this extended session together, going through the whole experience, that she'd had a very stressful experience during the IVF cycle, with work and everything, leading up to that transfer and the panic attack, and what she was left with and how she was feeling today. So we went through the whole experience using EFT tapping to release the negative emotional attachment that she still had to all of that. And she felt completely differently. It was lovely. She said she had warmth and tingles around her womb. And then she did go on to be successful and did conceive her baby. And I think her baby's over a year old now. And I think we see that frequently, don't we? Is that there is that obvious, very mind-body link. It's not even up for debate anymore, is it? We know the mind-body are one. We know that what we think affects our body, and what happens in our body affects our emotions. And it's an ongoing pathway. So I think we often see that, don't we? How this kind of support, emotional, spiritual healing from the recent past or the more distant past, whatever it is that needs to be done, does have such a massive impact, doesn't it, on their current situation, and as they enter medical treatment or whatever kind of treatment they're having, and helping their body become more receptive. So yes. And also right here, I wanted to include another little quote that we have, because we are here from the Alphazita team, as I'm sure many of you listening are very familiar with now if you've been to many of our webinars. And maybe you're in our Facebook group as well, your A to Z Fertility Club. If you're not there already, feel free to come over. But we are a truly holistic fertility team with medical doctors, with us as natural fertility practitioners as well. Rosie Letts also, who isn't here with us today, is nutritionist, who was at the last webinar. We have Dr. Sakos, who's our fertility consultant, and also Dr. Kannelina Bimpa within the team, and David Gibbons, the embryologist. So we're a very multi-dimensional team. And I asked today to Dr. Bimpa if she had something she'd like to share with us about a medical perspective to this mind-body work, this unseen side of fertility. And because we don't work in vacuums, we talk together and we all understand each other's fields, which I think is really important for you as the patient as well. And she wants me to share this with you. So I'm just going to read out this short quote that she sent me. She said, "The emotional aspects of fertility are, of course, very important, like they are in every other medical condition or disease. Hippocrates always said that the cause of every disease starts from the mind, and many diseases have their roots in the mental and emotional status. Emotional harmony is about better treatment results, better compliance to the treatment methods, and accepting the result in such a way that the person is still standing at the end. Because even if the result is negative, life still goes on." And I think that's something that we all agree with, isn't it? That it's so important to treat you as the person going through this, and not just the condition or the symptoms or the focusing on the treatment. It's looking at that person and their own mental, emotional experience too. So thank you, Dr. Bimpa, for sharing that with us today. Do any of you have anything else you'd like to share there? Because I know we have something else we'd like to move on to, which is different ways that people can now explore and expand on this work. So anything else that you feel we haven't covered that you'd like to? And if any questions need to be asked, feel free to send them in and we'll do our best to answer those before the end. Have we, ladies, said everything you want to at this point?
Yeah.
Yeah.
Good. I don't want to cut either of you off too soon. So yes, we were just touching on the team there, weren't we? And saying, what an amazing team Alphazita is and how many different ways we can support you on your fertility journey. There are many ways that you can keep in touch with us and also have us support you. One is through these webinars, of course, which you are already doing, so that's wonderful. Also in our free Facebook group, your A to Z Fertility Club, so do come over there if you haven't already. You can speak to and tag all the different members of the Alphazita team, ask us any questions that you have about your fertility, we're there to help you. But the most in-depth and personal way that you can work with us is through our Greek retreat, which is in a beautiful sunny resort in mainland Greece. It's a fertility retreat where you spend time with us, the Alphazita fertility team, for 3 days and have the chance to explore every aspect of your own unique fertility situation. So whether that is the medical side, whether that is the nutrition, or it's the mindset and the emotional and the spiritual piece, whatever it is that you want to look at, you'll be fully supported and guided through it over the time that we have together in the most beautiful surroundings, isn't it, ladies? It's just stunning, just gorgeous. And it's time for you to reconnect as well, whether you come by yourself or whether you come with your partner. It's time for you to reconnect to yourself, with each other, and with your true kind of vision of why you are on your fertility journey. Because I think we're all so busy, aren't we, day to day with work and life and appointments, and we don't ever give that space. I mean, Gordana, you were mentioning, 5 minutes a day. try and make 5 minutes a day, and some people will even be finding that challenging, and we can understand that, you know, it can be difficult to carve out time. But when you literally pack your bag, get on a plane, check yourself into the most stunning hotel and spend time with a team who are all supporting you, it's very easy then to really take a step into your fertility in a way that you haven't done before, and get the best support possible. So it is an intimate retreat. There are space, I believe, only for 7 couples, and we are taking bookings right now. So if that's something that is of interest to you, then you can find all the details at alphazita.com. You can also send us an email, just reply to any of the emails that have been sent through about this webinar, and get in touch with us and ask for a consultation on the phone, and we can have a chat with you about it as well. But do reach out if that's speaking to you in any way, because it's limited spaces, and we would love to meet you and at least talk to you about it and see if that's something you'd love to join us on. We know we'd love to see you there. It's in October, so sorry I'm not giving you the dates there, but 10th to the 13th of October, I believe. Was it 11th to the 13th? Am I getting that wrong?
10th to 13th.
Alphazita.com, but yeah, October this year. So it's time to start thinking about it, booking flights and getting organised with that. And that's the most comprehensive way that you can work with us, and that's in person. But each of us have something now, like a small step that you could take, towards exploring this whole unseen side of your fertility. Each of us has something special that we'd like to give you. So Claire, can you start with yours? It was the 5 guided visualizations, wasn't it, that you'd like to share?
Yeah, so I've done 5 visualizations that you can use. You'll be drawn to one, maybe more than the others. There's also a Love Your Womb ebook, which is just giving you lots of different ways that you can connect into your womb, into your wisdom, how you feel about being a woman. And I think there's also a workbook on there with connection to one of the visualizations. And then also I have an online program, which is a self-help massage. And there is a discount voucher as well on that link. So Sarah will be sending out the link, won't you?
Yes, that will be sent out. We'll be sending that out after the webinar. We'll send a lovely email out with all these links. So don't worry, you haven't got to scramble to get these now. We'll send out links in order to claim them all. And Gordana, I believe you're going to offer some free consultations.
That's right, to the first 5 people coming along. Yes, 20-minute consultation. It can be done either on Skype, or we can do that on the phone as well, or, you know, as an if, exploring what we were just talking about, how I do things, and how acupuncture works, and how the Chinese medicine view fits into this, and what we can sort of start the journey on, and that is open to anyone. The first Wonderful. 5 who are coming in, and there will be I'm sure sent an email via our Alphazita link, and then just get in touch with me.
Wonderful. So, and that's starting to create that space. You're providing a little bit of space.
Absolutely. A little bit of space just to open up a conversation, see where as you said, where we are now, where are we at the moment, and how I will be able to help there. Yes,
fabulous.
So yes, pleasure.
When
looking forward.
To all our viewers who are watching now, when you receive the email through, which will probably be tomorrow now, but when you receive the email through with the links and how to claim these, that's the email that you'll want to reply to claim that. Hopefully one of 5 if you're quick enough, and get that through for Gordana. Yes. Lovely. Thank you, Gordana. My welcome. Free gift that I'd like to give to anyone and everyone who's listening right now is an invitation to join me at my 7 days to Fertility Calm free challenge. So this is a 7-day experience that is happening. It's happening all in a very private Facebook group, and it starts a week today, next Monday on the 13th of May. And that's 7 days to explore the whole emotional piece of your fertility journey, to learn EFT, and then to be guided through using it. So we have short videos each day where I'm live and guiding you through the EFT process for different things, like blocks to conception, or dealing with other people's pregnancies, so many different things that we cover there. And actually I'll be covering whatever it is you ask for. It's space also for journaling and exploration, asking questions. It's just a very comprehensive way to easily start taking care of the emotional side of your fertility. So I'd invite you to join us there as well, 7 days to Fertility Calm, which will also send out the link for that to you as well. So I think we have gone slightly over this evening, but it's been lovely to share so much, and hopefully has really lit up those brain cells, thinking about what else could be going on in my fertility. You are so much more, aren't they, than a list of test results and a list of hormone profiles. You know, there is so much more going on in you as a person, as a parent to be, and it's something that we love to explore, as I'm sure you've heard. Any final words from both of you ladies before we say goodbye? Camera's on you, Claire.
No, I think it's just like you said. If people feel the call to do this work, if you've got questions as to why is this not working for you, connect in with one of us, of all of us. Come to our retreat, spend time with us, and unlock what's maybe going on a little bit deeper, what's not being seen.
Wonderful. Thank you. And Gordana?
Go exactly with that. Just get in touch and feel free, really, because this has all been one big journey for us as well as practitioners, and opening up avenues with one another, and then with for the benefits of our patients as well. Honestly, just get in touch. We are here to support you, help you. We're extremely passionate about it. I know all of us are in our own way, and there are so many ways that you can be helped and supported, so many different ways, as you said, not just a hormonal profile or a set of tests. It really is not end all and the final thing. It's just so many more things for you as an individual person, for every one of you listening tonight. So lots of hope for you. So get in touch. We are here for you.
They've taken a very big first step by joining this webinar, this mysterious sounding webinar, The Unseen Side of Fertility. And we hope it's not so mysterious anymore, and that you have an idea of the path that you're going to be following. So if you would like us to support you on that path, yes, do get in touch. Come to alphazita.com, come to our Facebook group, the A to Z Fertility Club, and we'd love to continue supporting you and continue this conversation with you. So thank you very much to both of you for joining me this evening, Gordana and Claire. Thank you. And thank you to everyone who has listened in this evening. It's been lovely to have you join us, and we look forward to hopefully speaking to you again soon. Wishing you all the best. Take care. Bye-bye.
Bye-bye. Bye-bye.